Sexually transmitted disease. It is an STD and it is caused by spirochete, and the name of the bacteria is called Treponema Pallidum. Treponema Pallidum. So this Treponema Pallidum is a gram-negative bacteria. It's a gram-negative bacteria and spiral shaped. It is spiral shaped. It's spiral shape and it's a gram-negative bacteria, and though it is gram-negative, but it don't have the usual polysaccharide covering like the other gram-negative bacteria. So let's start with what are the unusual features of this bacteria, what makes it different from other bacteria. So what makes it different is that it has endoflagella. It has endoflagella which makes it motile. It makes it endoflagella. So these are endoflagella. It serves like a motor. It gives a longitudinal movement. Endoflagella. Along with that, which makes this bacteria very unique is that the surface membrane, in the surface membrane of this Treponema Pallidum, there are less antigenic proteins in comparison to the inner side. Means antigenic proteins present on this bacteria are very few or very less. More are present inside. More are present inside. These proteins are more inside. So because of the less antigenic protein present in the surface membrane of this Treponema Pallidum, so what is happening? What happens is that the starting of the immune system or the ignition of the immune system is very less. Means there is less antigens available for binding of antibodies. So that is why vaccines don't work. If there is any vaccine here, vaccine cannot work against this syphilis bacteria because there is antibodies cannot work against so easily on syphilis or on bacteria like a Treponema Pallidum because there is less antigenic sites. So this makes this Treponema Pallidum very easy to evade the immune system. That's why this bacteria is also called as evader. It is invasive and evasive. So Treponema Pallidum is both invasive in nature and it can evade from our immune system. That's why it's called evasive. Okay, so it is both invasive and evasive. So this is the reason why it can go for a latent phase for a long time without the killing by the antibodies because it has less antigenic protein over the surface membrane. Another thing is that which makes it very unique and which is also very important for you to know that the metabolic rate is very less in this bacteria. There is very low metabolic rate. Okay, low metabolic rate. Now why it is this? Because this Treponema Pallidum, this T. pallidum bacteria has got no genes coded for enzymes needed for Krebs cycle or oxidative phosphorylation. There is no genes. It has genes that code for transport proteins. So you can say there is no genes meant for Krebs cycle, meant for oxidative phosphorylation reactions. So that's why it has less need. So when it has less need, it can survive for a longer time in any hostile environment, like in the environment where there is lots of immune cells are there. So because of the less need, because of the low metabolic rate, so because it has no genes totally needed for any sort of metabolic reactions meant for Krebs cycle, rather than the genes that are present in the bacteria, it codes for the transport proteins or transport of amino acid transporter proteins like that. So that makes this bacteria very unique, and because of this particular structural thing and absence of surface proteins and absence of genes, absence of these metabolic enzymes, it makes this bacteria very strong to last in a human environment. It makes it last longer. Also, because of this, it can evade our immune system. So that makes it very unique. So the incubation period is, though it is 21 days, But there's a high range, there's a variable range, it goes from 10 to 90 days of incubation period. So that is about the bacteria. Now let's move to the other side of the syphilis, how it causes syphilis and what are the pathophysiology. So the pathophysiology starts with the primary chancre, the primary lesion. So when you say the primary lesion, it has a painless nodule develops which is called as chancre, and there is a regional lymphadenopathy. Regional lymphadenopathy. So this chancre that is developed, it is painless. So the chancre that is developed is a slight ridges and it is painless, and there is spirochetes present in the fluid. Okay, there is some fluid here, and you can see there are some spirochetes. So you can say it looks like a swimming pool here where these spirochetes are there. So when you do dark ground microscopy, we basically make a smear of this thing so we take a smear from this thing in the chancre, which is a painless, and we make a smear, and then when you see it and throw some light in a dark background, it just glow like when you see the shine of light coming through the door or window, you can see the dust particles. That's the way it glows when you put a dark background and put some light. That is the basic of the dark ground microscopy. Okay, so this chancre is a painless thing, and it usually comes after 21 days of the infection, the primary inoculation, 21 days, and it develops at where there is a mucosal break. When there is a mucosal break after the sexual contact, then there is a invasive nature of this bacteria makes the development of a chancre locally at the genital area. Along with that, the chancre, there will be also lymph node will be also inflamed. Basically, that lymph node is close to that site. What we call as inguinal lymph nodes will be enlarged in size, and it's always bilateral. Most of the time it's bilateral. So we call it regional lymphadenopathy. So if you can see here, so these are the cells, and from here, this spirochetes, they can easily, if there is any breach or any break in the epithelial cell, they can easily go to the submucosal layer. So in the submucosal here, we know there is a lymphatic vessels, and also there is blood vessels. So in the primary lesion, when the primary syphilis, okay, there is not yet any spread from the blood. No blood spread here till now. It basically goes to the lymph node, lymphatic vessels, and inflame the lymph nodes. So we call it regional lymphadenopathy, and it can go very fast, but it has a particular motion that is called as go and stop motion. It goes for a while, then it will stop. Again, it will go for a while, then again it will stop. So the motion this bacteria, it goes called go and stop motion. And this bacteria multiplies, and then when it will multiply, and it will induce an inflammatory reaction here. It will induce our immune system, the antibodies, definitely they will come, and there will be an inflammatory reaction called as chancre, though it is painless. So that is the primary lesion. So primary lesion usually lasts for 6 weeks, and after 6 weeks, then that's an average I'm telling, that's after 6 weeks, then we go to the secondary stage. Secondary stage, there is mucocutaneous lesions. Mucocutaneous lesions in the secondary stage. In the secondary stage, there is mucocutaneous lesions. There will be wart-like lesions, okay, all over the body. It means the whole thing is, there will be now generalized. There will be maculopapular rash, okay, maculopapular rash. And there will be this wart-like lesions will be developed, which is called as condylometallata. So this secondary syphilis also lasts for 6 weeks, and now in the secondary syphilis, the bacteria is almost now traveling in the blood vessels, so it is very, very highly infective. Lots of treponema, lots of syphilis bacteria in the blood vessels. So this secondary phase is very, very highly active and infective, okay, and because it is now has gone to the blood, and there is, we call it the spirochetemia. So during this time there's lots of inflammatory reactions also occur, and there will be, now the lymph node is not be regional only. Now it is the lymph node will be, most of the lymph nodes in the body will be there. They are having swelling or enlarging size. So we call that term the generalized lymphadenopathy. So along with the mucocutaneous lesions, which are the skin lesions, now plus generalized lymphadenopathy in secondary syphilis. So this stage also lasts for 6 weeks. So after 6 weeks, means after healing of chancre, after 6 weeks, so after 6 weeks of healing of chancre, there is a development of secondary stage. This secondary stage also lasts for 6 to 8 weeks, and after that it can go for latent stage. Okay, so after this we can go to a latent stage. So from the secondary stage it can move to latent stage, or if it is not treated then it can move to tertiary stage, which is the severe stage. So this latent stage is that stage when there is no clinical feature, the chancre, the lymph node, everything is being healed because of our immune system, and now the bacteria has gone for hiding. So in this latent stage can last for decades. It can last for 10 years, 15 years, 20 years, and the bacteria goes on hiding and it can come back. So from this latent stage, either the patient can self-recover, it can have self-recover, or there is tertiary stage, it can go for tertiary stage. So there is no time limit for latent stage. Okay, so from the latent stage, patient may still have the bacteria in the blood, or he can go for later on when the immune system is down or in other conditions, this bacteria can come back and it can go tertiary stage. So in the tertiary stage, though it is not so common nowadays because of the high aggressive therapy by penicillin, because penicillin is the best treatment for syphilis. So because of lots of early diagnosis and interventions, tertiary stage is found to be very, very rare. But if there is tertiary stage, what can it be? So first of all, it can invade the brain, okay, what we call as neurosyphilis. So in neurosyphilis, this bacteria, it is assumed to be present, bacteria said to be present in CSF. But let me tell you that as soon as there is in the late part of early stage or in the secondary stage also, this bacteria can be present in the CSF, though they may not show any signs and symptoms of neurosyphilis. But when there is tertiary syphilis, when the patient is coming back after latent stage and he has gone to tertiary stage, then there is a development of neurosyphilis when there is the dorsal column of the spinal cord can be affected. When the dorsal column of the spinal cord is affected, we call this dorsalis tabes or tabes dorsalis. As a result, there is loss of proprioception and vibration. Okay, so vibration will be lost. Joint sensation, proprioception will be lost. But it is not only limited to the posterior horn of the spinal cord, it can also come up to the anterior side of the spinal cord, and there is leading to paresis. Paresis, which is weakness of the muscles, and sometimes it can cause paralysis also. Along with this, in the neurosyphilis, there is gross loss of the personality, dementia, there's a down in the mood, depression, low mood, mood disorders, psychotic problems, and there is also dementia, which is the point to be noted. There can be dementia. Okay, so what we did found in the tertiary syphilis, one is neurosyphilis. The second thing, it can affect also the patient heart. So what can happen in the heart? It can, in the arch of aorta, it can cause aneurysm. It can cause aneurysm of aorta. Aneurysm. By doing aortitis and aneurysm of aorta, it can cause aneurysm. So what is called syphilitic aneurysm. that is in the heart. And next, in the blood vessels, small blood vessels present in the skin, they may be blocked because of perivascular inflammation. Because of perivascular inflammation, the small vessels can be blocked. So when the small vessels are blocked because of perivascular inflammation, we call that term as a end arteritis obliterans. So there will be end arteritis obliterans. So when there is end arteritis obliterans, then if these vessels are small vessels are blocked in the extremities, it can lead to gangrene of the distal part. It can lead to distal part will be having hypoxic things, and it can lead to destruction of the tissues also. But this is not a diagnostic point for tertiary syphilis, because this end arteritis obliterans is also found in radiation poisoning or also in tubercular meningitis. But it is often seen in tertiary syphilis. So along with that, tertiary neurosyphilis, end arteritis obliterans, there is aneurysm in the aortic arch, and it also affects the eyes. So this syphilitic bacteria, it very commonly it is found in the aqueous humor. Okay, it is very found in aqueous humor. It's very commonly found in aqueous humor, and it can cause optic neuritis. Optic neuritis. And also it can cause, there is loss of light reflex. Loss of light reflex, which is that when you throw light on the eyes, the pupils don't contract. But the accommodation reflex is often present. That's why we call this condition as a Argyll-Robertson pupil. Argyll-Robertson pupil. Along with this, eye symptoms, there's aneurysm of aorta, end arteritis obliterans, there's dementia, tabes dorsalis. There's one more thing that is found here in tertiary stage is gamma. When there is gamma is formed, it is a, what you can say, there is lots and lots of immune cells making a round body. It is a nodule, okay, and there is inside there is coagulative necrosis. There is coagulative necrosis inside. Coagulative necrosis inside, with a layer of immune cells, and there is fibrosis. And this is a non-cancerous lesion, but it looks like a nodule. Okay, and this is called as a gamma. And the most common location for gamma is in liver. So these are the things that we can find in tertiary syphilis. We got neurosyphilis, in the neurosyphilis we got tabes dorsalis, then there's personality loss, dementia, okay, then we got reflexes are reduced, then in the heart there can be arch of aorta is affected, causing aneurysm of the aorta, then in the eyes there can be optic neuritis, Argyll-Robertson pupil, and there will be widespread or localized, sometimes we can get gamma. Most commonly it can present everywhere, but most common location is the liver. So these are the features of tertiary syphilis. Then what are the features for congenital syphilis? So it can also have two type of thing, when the baby is less than 2 years old or the baby is more than 2 years old. So less than 2 years old, they can have some stuffy nose, always blocky, nose is blocked because of presence of spirochetes, stuffy nose, and there can be liver and spleen damage. Liver and spleen damage. Liver and spleen can be damaged. Also, there can be maculopapular rash. Maculopapular rash. Plus, there can be signs of optic neuritis. And when the baby is more than 2 years old, it can result in some other deformities. It can result in other deformities like there is the nose, the nasal septum can be depressed. So when there is a nose, say, and it is depressed, so it looks like a saddle. So we call it saddle nose. Then the teeth, when there is in the teeth, so these are the teeth. So there can be notch. There can be notch. There can be notch in the teeth. Notch in the teeth. So when there is a teeth are present like this, notch teeth, we call Hutchinson teeth. Hutchinson teeth. And there can be also the tibia can be bent, anterior bending of the tibia, we call it shaver shin. Along with there is progressive deafness. There can be loss of hearing. We call progressive deafness. So these are the late features of congenital syphilis, which can be present in a child more than 2 years old. Now coming to the investigations, what will you investigate here? Okay. Non-treponemal and treponemal. So they are non-specific tests. So first of all, we know that is dark ground microscopy. Dark ground microscopy, where we make a smear from the chancre and put it in a dark background, and we see the spirochetes, they glowed. Okay, that is called dark ground microscopy. Then we can see rapid plasma reagent test, rapid plasma reagent test, VDRL test, sorry. So these tests are basically, they are meant for against cardiolipin. So this cardiolipin is also secreted when there is a lots of tissue damage. So that's why they are not so specific, because they go for anti-cardiolipin. So more specific is the fluorescent treponemal antibody absorption test, which is very, very specific and highly recommended. So these are the serological tests. Then treatment, penicillin is the best treatment for syphilis, any kind of